Hello, my name is Maddie.
And my name is Allie, and we're with the Steve Rumler Hope Network. Today, we're going to be demonstrating how to use fentanyl test strips. So these strips can be used to detect the presence of fentanyl and some other common synthetic opioids.
Fentanyl is a very strong opioid and can be 50 times more potent than heroin. As a result, there's a much higher risk of overdose, especially if somebody doesn't know they're at risk of exposure. Because of this, fentanyl test strips are an important public health tool for overdose prevention.
In recent years, fentanyl has become much more commonly used to lace other drugs, including heroin, cocaine, methamphetamines, benzodiazepines like Xanax, and even vape products. It's also frequently pressed into pills and sold as off-market medications. With the risk of exposure being so high, it's important for people to test their supply for fentanyl and to always practice safer use strategies, regardless of their test results.
Fentanyl test strips have three basic areas. The dark blue section is where you hold your strip while testing. You should only touch the strip here, as contaminating the other areas may impact your results. For this reason, it's also important to keep your strips in the sealed packaging until you're ready to test, to prevent the strip from getting dirty or damaged. The middle section displays test results with red lines and is blank before testing. The bottom part of the strip, the test area, is marked with blue lines and arrows. This is the part you'll dip into the sample. When preparing a sample for testing, it is important to remember that fentanyl can clump together and be unevenly distributed. This is known as the chocolate chip cookie effect. One area might contain no fentanyl, so testing just that small amount may not lead to accurate results. Think of a chocolate chip cookie. It's possible to take a bite from a part of the cookie that has no chocolate at all. However, if you blend up the cookie, it should be impossible to have a bite that doesn't contain at least a little bit of chocolate.
Think of the substance you're testing as the cookie and the fentanyl as the chocolate chips. Results will always be the most accurate if you fully prepare and dissolve the entire amount you intend to use in water before testing. We've dyed the water used in today's video to make it easier to see, but normally it's important to only use sterile water. Testing with other liquids will yield inaccurate results. After testing, if you decide to proceed with use, you can drink the dissolved substance. Samples can be prepared in a cooker, a cup, or a baggie. These instructions use milligram and milliliter amounts, but we realize not everyone will have the tools available to measure these amounts exactly. A milliliter is about 1/4 teaspoon, so you can measure that using a clean syringe or a standard measuring spoon. Alternatively, this is 1/4 teaspoon in a bottle cap. Here's what it might look like in a standard kitchen spoon, a cooker, or a cup. We use 10 milligrams as the standard amount for testing the substance itself. Ideally, this should be measured using a milligram scale or a properly sized microscope. 10 milligrams can also be visually estimated as about enough powder to cover Lincoln's face on a penny.
So for injectables, you'll want to prepare the injection as normal, then set it aside. Add 1 milliliter, again that's about 1/4 teaspoon of water, to your spoon or cooker and swirl around to distribute the contents evenly. For tablets, first crush them into the finest powder possible, then add just enough water to fully dissolve all of the powder. Some binding materials may not always dissolve, and that's okay.
For powders and crystals, you'll similarly need to crush them into a fine powder before adding the water. Most substances should be mixed using that 1 milliliter of water for every 10 milligrams of powder. Remember to scale up the amount of water you are using if you are testing more than 10 milligrams of a substance. Some drugs, like methamphetamine, may require different amounts of water for accurate testing. Please see the linked information below for those specific dilution rates.
Representative sample testing is not the best option for testing. However, not everyone is willing to dissolve their entire dose in water every time they use. The next best option is to try to obtain a representative sample. It is important to note that this method may not accurately detect unevenly distributed fentanyl. You'll still want to crush or chop any powder or crystals into a fine powder. In a baggie or a dish, mix the powder to evenly distribute the contents. Take a 10 milligram sample and mix it with 1 milliliter of water.
By far the least effective method is going to be residue testing. Some people opt to test the residue stuck to the inside of the baggie the drugs are stored in, adding 1 milliliter of water to the baggie and swishing it around to dissolve the residue. However, it's impossible to know exactly how much residue you're going to be testing, and this method is the most likely to fail at detecting fentanyl due to the chocolate chip cookie effect.
Now that you have your sample prepared, remove the strip from its packaging. Hold the blue end of the test strip and dip the other end into the liquid up to the blue test line. Keep the strip here for 15 seconds and allow the liquid to soak up to the result area. Do not dip your strip past the test line, as this may impact your results. After about 15 seconds, remove the strip from the water and set it down on a sterile surface or across the top of a cooker. Wait about 2 minutes for your result lines to appear.
There are 2 red lines that may appear in the result area. The control line is higher on the strip, closer to the end you hold. The test line is lower on the strip, closer to the end you'll dip in the sample. If only the upper line appears, the sample has tested positive for fentanyl. If both upper and lower lines appear, the sample has tested negative for fentanyl. If no lines or only the lower line appear, this test is invalid and you should retest using a new strip. As a reminder, the manufacturer's packaging and the instruction card provided in Steve Rumbler Hope Network kits have keys to help you interpret these results.
It is important to remember that no test is 100% accurate and no drug is 100% safe. These tests cannot detect every synthetic opioid, and user error can also impact your results. Even if a drug tests negative for fentanyl, you should always proceed with caution and have safer use strategies in place.
Try to use only one substance at a time. Never use alone. Use slowly and take smaller doses. Do a test dose, especially for a new source or type of drug. Be sure to use clean needles when injecting, and always have naloxone on hand.
As the risk of accidental fentanyl exposure rises, it is important that individuals are able to test their supplies and make informed decisions about their use. These tests can help people avoid using fentanyl-laced substances entirely, or take additional precaution when using these substances.
Fentanyl needs to enter the body through ingestion, injection, or the mouth, nose, or eyes. It is very unlikely to be absorbed across healthy, unbroken skin. Fentanyl patches, which are used to administer fentanyl medically, rely on additional mechanisms and prolonged contact to absorb through the skin layer. While you should always be aware of your surroundings and exert caution with suspected fentanyl, the immediate risk of skin contact is reasonably minimal. We recommend using protection like gloves when handling unknown substances, avoid touching your face, and wash your hands thoroughly after potential exposure.
Fentanyl is an incredibly potent synthetic opioid. Naloxone will still be effective, but it may require additional doses to successfully revive an individual experiencing an overdose caused by fentanyl.
Again, no test is 100% accurate, and no drug is 100% safe. Some synthetic opioids are not detected by these tests, and any test has the risk of a false negative result. Anyone proceeding with use, regardless of their test results, should always practice safer use strategies to help reduce potential risks, such as overdose, infection, or contracting hepatitis or HIV.
Avoid using multiple substances at the same time, including alcohol. Never use alone. Use slowly and take smaller doses, known as going low and slow. Use sterile supplies for preparing and administering your drugs, especially needles, which can be found through syringe exchange programs. Do a test dose before using larger quantities. Consider alternative methods of consumption, and always have naloxone on hand.
The instructions in today's video are those that have been established by harm reduction groups, but methods and best practices may change over time with additional research into these tools. For relevant updates, more information about fentanyl test strips, and available treatment resources, please visit rumblerhope.org.